Welcome back in. Vascular disease is something that affects millions of Americans, but many people don't realize just how serious or how common it can be. We're sitting down with Dr. Mohamed Osman, President and Chief Medical Officer at ProMedica Jobst Vascular Institute, to learn more. Thanks for being here today.
Thank you, Amanda.
First of all, what exactly is vascular disease? What are some of the most common types?
Yeah, that's a great question. So, blood vessels are the pipes that carry blood from the heart to different parts of the body or back to the heart. So there are arteries and there are veins. The main diseases are either blockages or weakness in the wall and enlargement that we call those aneurysms. Those are the two main common ones.
And we hear about aneurysms and having complications if they burst or different things like that, which can be pretty serious, huh?
Absolutely. Aneurysms tend to be life-threatening, and if they get too large, just like a balloon, it can rupture at the end, and the people can bleed from them.
Sure. So let's talk a little bit about what some of those risk factors may be for developing vascular disease then.
Yeah, risk factors for vascular disease tend to be either acquired risk factors or inherited risk factors. Smoking is one of the big risk factors that are actually controllable. High blood pressure, diabetes, high cholesterol, family history, and age. But we tend to focus on smoking because it's one of the very modifiable risk factors.
And preventable, you know, if you make some changes there, you might be able to prevent the disease, which is huge. Is there a way to know, like, I have this aneurysm and there's something that I could do to treat that before there's a rupture, or what kind of treatments are available for people with vascular disease?
Yeah, so this is where we made significant improvement in the types of procedures that we can offer to treat those patients. Now we have minimally invasive procedures. We call them endovascular, where we go with needle holes, catheters, and wires, and small pipes, where we can put what we call stent grafts to seal and exclude those aneurysms. And we actually can open up blockages the same way with minimally invasive. It's huge improvement on what we can offer to our patients. Patients tend to go home the next day and have better outcomes compared to big open surgeries that we had to do in the past.
Right. So what kind of you know, techniques and different things would be specific to the Institute there that you may not be able to get or are new to the area that previously weren't here?
Yeah, I'm very proud to say that at the Jobst Vascular Institute, we do provide state-of-the-art services through state-of-the-art technologies. There is no procedure that can be done anywhere in the country that we don't do at Jobst.
Oh.
Yes, and we have specialists that function in a multidisciplinary fashion in collaboration with our colleagues from other service lines, as well as cardiac surgery, neurosurgery, neurology, and other service lines. And we do have multidisciplinary approach. We have state-of-the-art technologies and facilities, and we practice evidence-based medicine, and there's nothing that can be done anywhere else that we don't do.
So that's got to be reassuring to patients here in the area who maybe otherwise would have had to travel, you know, hours from here to receive some treatment or care. Absolutely.
One of the newest development is we established our aortic care network at ProMedica, where we provide advanced aortic care. The aorta is the largest highway, if you will, or blood vessel. And we do manage those patients with complex aortic aneurysms and dissections and weakness in the wall. And in collaboration with our cardiac surgeons, we work together as a team, and we provide services close to home so patients don't have to travel hours and hours out of the area, and with great outcomes.
That's important too.
Very important.
We want to have the good outcomes. So if there are people out there, what are maybe some of the signs or symptoms that they want to look for to see, hey, maybe I need to check in with my doctor?
Yeah, so for blockages, people, depending on the blood vessel, people tend to have different symptoms. It could be pain in their legs or difficulty with walking, feeling tightness. In the aneurysms tend to, most of the time, be silent. That's why we do screening programs.
Sure.
So at the Jobst Vascular Institute, collaborating with different parts of the community, we do offer screening programs. Some of them are free screening programs to identify those. And we do follow guidelines. We have the Society of Vascular Surgery has guidelines to screen those patients.
So, and even maybe that family history might come into play there too. If you're like, I know that I have this family history, time to maybe stay on top of it, right?
Absolutely. This is a good one. Family history and smoking history. Anyone above the age of 65 who ever smoked or have a family history of aneurysmal disease should be screened for abdominal aortic aneurysms.
Very good. Well, there you have it. There's your sign right there. Doctor, thank you so much for being here today.
Thank you very much.
Yep.
Yeah.